Hello again. I'm back, Javed Akhtar. Today is the 8th of February, and I'm going to take you for a quick tour of our third clinic for the Health Hyderabad. That is in an area called Gunrock. Gunrock Enclave. I'm just turning you around. It's this busy part of it. There's a big hotel here, and it is in the basement of a building that the Qadris own. So we don't have to pay any rent for it. So let me walk up there. You can see the sign, and it's very nice and neat and clean. And you can see the potted plants, and it's every day except Sunday between 5 and 9. Between 5 and 9. So we step down into the basement and we'll be entering the waiting area. They tell me that the average number of patients they are seeing is about 35 to 40, which is a lower number than the other two centers. The folks take out the shoes, of course, and I'm here in the waiting area. Today it appears to be quite full, and here is the receptionist, and right next to it would be the area where they get the vitals done, and again to get a pan of the waiting area here, and then we then go and see the physician, Dr. Riaz. You know Dr. Riaz, I think we have video of him from 3 years ago, so he's back. Nice to see you again, Riaz. Thank you, sir. Please go ahead and introduce yourself and say what you're doing. Go ahead.
Yeah. I'm Dr. Riaz. I have done my MD Community Medicine, and I'm associated with Health Hyderabad since last 3 years.
You are a professor, you're teaching what?
I'm teaching social and preventive medicine, sir. I'm assistant professor.
At which college again?
At Mallareddy Medical College.
Mallareddy. And Dr. Riaz is here between 5 and 9 every day that's except Sunday, of course.
Yes.
Would you like to add anything or something you're missing that you need to do more of?
Nothing, sir. We are
Not much, but you let us know. Feel free to let us know if there is anything, I know you are in constant communication with the Qadri, Sama Qadri, and Visa Qadri, so please don't hesitate. Again, thank you very much. Thank you for working for us. That's a great honor for us. Thank you so much. Now I'm going to walk over to this next area where we can do some IVs and other minor surgeries and so on. So I'm going to skip that. There are some women here. I walk over to this area, which is the dental area. Now the dental area or a dental chair is very rare. I was recently at a meeting of NGOs, health clinics, and there were very, very few which had a dental chair in it. The main reason is that it's very, very expensive. So what I'd like to do is, at this time, introduce you to a dentist. She's the star of our little setup here, and I've asked her to introduce herself and tell us a bit about what she does. So please go ahead.
Hello, I'm Dr. Sair Abdul Sami. I'm a dentist over here, and I'm working over here from past 2.5 years. I'm working over here from past 2.5 years, and this is my dental equipment. I'll show you my dental equipment. Please have a look over here. This is all my root canal instruments. This is my light cure, which we are going to use for the composite filling, the permanent filling. And this is my endomotor, which I'm using for my root canal procedures. These all are my instruments. This is the apex locator we use in our dental equipment. This is all the fillings over here, and this is our dental chair. We have all the equipments over here. All the instruments are sterilized over here. This is our X-ray equipment, which we are using over here. X-ray development. We have the developer fixer over here. This is our sterilization machine, and this is our compressor over here. And recently we have purchased this suction motor, which is highly equipment, which helps for suctioning easily to do our work over here.
That's very impressive.
This
So
is
you have
our
everything,
X-ray
yeah.
machine.
Yes.
This is my X-ray machine.
So how many patients are you seeing? You're here every day, right?
9 to 10 patients over here. Maybe it increases also, like 20 members also it comes. Usually I do the treatments over here. 3-4 treatments I'll do. 4 root canals, 3 to 5 fillings I usually do over here.
Okay, tell us about your charges. You know, we are running this as a free clinic or subsidized clinic for the poor. So give us some examples of what a procedure would cost in a regular dentist and what you're charging.
Yeah, regular dentist usually in our field it charges about 4,000. It's a minimum rate, 4,000 per root canal, though it is anterior or posterior. So, but over here we used to see the patient below poverty line. So I charge over here maximum below 2,000, like 1,500 to 2,000. And if they are very much poor, I reduce the rate also. Fillings, 500
Can they even
bucks.
pay the 1,500 to 2,000?
Some patients don't afford to pay. Even they are like some patients, they don't have their mother or father. They don't afford to pay. So we decrease more,
Can
like
you do it
500.
for free for some patients?
Yeah, I have that. The one who is very much non-payable, we used to do the free for them also. And we have the free medications for it. Antibiotics I usually give, painkillers, B complex, Metrogel 400 mg. I usually prescribe 5 tablets for every patient. It is necessary. They'll come with the abscess, dentoalveolar abscess they come, impaction cases they come with cancer patients also I have seen them. We have a very group of chain, so we usually transfer them for the cancer patients. So takriban I think last 2.5 years I got 4 to 5 cancer patients.
Is it oral cancer from tobacco or what?
Yes, it's oral cancer from tobacco, the pan chewing, and they have removed the full jaw for them or half of the jaw, which was hemicectomy.
Pan with the tobacco in it, right? Or just regular pan?
Pan with tobacco. It's called something gutka.
Gutka, yeah, gutka.
Yes.
Yeah,
We usually get these patients a lot.
yeah.
Pan eating is very much common in dentistry. Usually get more patients regarding to this. And the age criteria for these patients is very young patients are there. Like
cancer?
12 to 20. Pan eating.
Pan
Cancer
eating,
is like
pan
40 years.
Pan eating is very common.
Yes.
Yeah, we know that. Anything else you want to add? Are you happy with the work you're doing here? Is it satisfying for you?
Yeah, Alhamdulillah, I'm satisfied over here. I'm very happy over here. So that's the reason I'm like stable over here from past 2.5 years.
That's wonderful. Do you do something else in the morning or you don't?
Right now I'm not doing anything in the morning.
Okay, fine. Is there anything else you want to add?
No, nothing.
So I just want to thank you for doing this for this NGO, and we're far away in the US, and we imagine, and when we come here and we find our imagination is actually being realized and fulfilled, that's terrific for us.
Yeah, thank you so much.
Thank you very much. I've heard nothing but good things about you from everybody.
Thank you so much. Even I'm trying to increase my dentistry level into a very next level. I'm trying to increase that. We're having our dentistry field is vast. So we are not only restricted to do impactions, like root canals. We're having many things in our field. Even I do the small kids root canal also. We are trying to get to the next level.
How are the youngest you're doing right now? What is the youngest you're doing? In age? Yeah.
My age?
No, in the root canal, what is the youngest patients you're seeing?
4 years.
You're seeing kids as young?
Yeah, it's very difficult to handle them, but I'm trying to handle them. It's okay, Alhamdulillah.
Thank you so
Thank
much.
you so
it's
much,
a delight
sir.
to get to know you.
Thank you
very
so much. Thank
So let me move over here and very quickly to the pharmacies. area. I don't know if the pharmacist is here. I think he is here. So let me talk to him. So I'll go over here.
My name is Mohammad Abdul Ghaffar. Studied
Just relax, relax.
studied BSc in medical science. We are providing all types of antibiotics and painkillers. Those who are not able to take medicines from outside medical shops. We are providing free medicine like amoxicillin 625 mg, 500 mg, and many others, cefixime. We are also providing patients of BP and sugar, thyroid patients 30 tablets per month, and they are also contributing with us.
So for diabetes, you have metformin,
metformin,
thyroxine, you have.
thyroxine
What are
20.
you giving for hypertension?
Hypertension, atin 25 mg and amlodipine, Telma 40 mg.
Excellent. Excellent. And what else? Is there anything you look like it's very
We are-
well stocked, right? Fully stocked. I can see this here. MashaAllah.
And also we are providing IV for only 70 rupees IV sets, DNS, NS and RL. And also we are providing PAN 40 like injections, PAN 40.
What is
vitamin
PAN
C.
40?
PAN 40, this is for acidity. Sir.
Uh-huh.
This is-
Oh, that would okay, got it. So are you happy working here?
Yes, sir, happy.
Okay. But thank you very much. I won't hold you because I see you have lots of patients with you. Thank you very much. So I am going to introduce you to say hello to Dr. Mr. Kidwai, who is the internet person. I think we talked to him yesterday, and we'll sit down and chat some more about 3 or 4 things that we could do.
But this should be the ideal clinic because
should be
here,
the ideal.
yes, because
But the
here
numbers are quite small, but it's
yeah,
still
number
okay.
is small, but here we can think about.
You can think of it. Maybe this should be the place
Yes.
you want to start.
Yes.
Okay. Thank you so much.
Thank you.
So again, Mr. Hadri came with us even though I think I was like 3 hours late. But I only blame myself partially.
No. I
blame
don't say that.
Hyderabad traffic for the rest of it.
Yes, we can always blame it on the traffic.
It's not all traffic.
आयन हैदराबाद के लिए 3 घंटे कोई ऐसी एक्स्ट्रा ऑर्डिनरी चीज़ नहीं. अब ये कुछ बोलना है आपको?
Can I add one more thing?
Yeah, please do.
Actually, can I,
There. Okay, go ahead. Yeah. Please.
this is like patients we are seeing,
Yeah.
and
Can I
actually,
take a picture?
yeah, please. The thing is like we are having a MDS staff over here, Dr. Muqtadir. So he's coming all the way from nearly 10 kilometers to
He's
serve. Yes, he's a surgeon. He's
Kya
a
naam hai? What's his name?
oromaxillofacial surgeon, Dr. Muqtadir. He's coming all the way from like max 10 kilometers to serve in our NGO. So he usually do the cases of impaction over here,
Is
surgery
he doing it
impaction.
mostly because this is an NGO clinic?
Yes, and he usually charges very minimal. Usually the MDS doctors, they usually charges above 5,000, but he charges very minimal, like even for, usually he do free for us also. Very much like 1,000 he charge, or else he do a free for us over here. So whenever the cases is there, I'll keep the cases for him. He will come all the way and he does the cases over here. This is what I need to add this one.
Okay.
And this is my daughter-in-law's brother. Oh, yes.
Oh, I see. Assalamu alaikum. क्या हो रहा है? क्या हुआ?
जी थोड़ा दांत में गैप आया है शायद, तो कुछ खाए तो अटक रहा मॉर्निंग
अच्छा, खाया तो अटक रहा
जी, तो वो बताएंगे बोल के आए.
अच्छा. अगर ये बोले कि आप बिरयानी खाना बंद कर दो तो बंद कर देगा.
उसका भी उनके पास इलाज होगा शायद, उसको फिलिंग करने के बाद
के बाद बिरयानी खा
जी.
सकते. ओके, ठीक है.
ये हॉस्पिटल आए जब से बहुत सबको बहुत हेल्पफुल हुआ है.
जी.
बहुत मतलब इवनिंग के टाइम पे भी हम लोग बहुत बार आए भी यहाँ पर, मतलब बुखार आने पर, और दवा वगैरह भी बहुत अच्छा देते हैं.
चलिए, माशाल्लाह.
जल्दी भी कम होता है हम लोग को दवा से इफेक्ट से.
शुक्रिया. थैंक यू सर.
जो भी है उनके लिए बहुत थैंक्स है भाई.
आमीन.